do not have any who are on the other 3 units. So that's what it means for them to be quarantined. So they're separated from the rest of the facility. They also should not have activities in groups or congregate settings, including meals. And if they have activities that are required for them to be able to have time outside of their room, their patient care setting, that should be limited to 1 at a time or in very small group settings. So that's what it means to quarantine a unit.
And I know the nurses are concerned that there are no negative pressure rooms at the hospital, and that I know the nurses union also said that 30 nurses are out on quarantine, creating major staffing problems. So can you just address those 2 problems that I know the nurses union have said?
So one of the things that is important to remember about St. Elizabeth's as a hospital is that an individual in St. Elizabeth's Hospital does not necessarily mean that the individual is hospitalized for the treatment of their COVID status. So when we talk about the need for a negative pressure room for the treatment of COVID-19, that is not the care that they would be receiving at St. Elizabeth's Hospital, which is an aerosolized procedure, et cetera. So the number of negative pressure rooms necessary at St. Elizabeth's Hospital, which is a psychiatric hospital, is not necessarily the same that is required for an acute care hospital that would be providing treatment for the COVID-19 condition. So recall that for many of the individuals who are in St. Elizabeth's Hospital, but for their COVID-19 status, these individuals would be recovering at home. But for their psychiatric diagnosis, many of these individuals would be recovering at home with their COVID-19.
Okay. And the staffing problems, are there plans to get more support in there, or is the 7 total personnel out okay?
We have worked directly with the leadership of St. Elizabeth's to ensure that they have adequate staffing as well as adequate personal protective equipment to care for the patients in their custody.
Thank you. Is anybody next on the phone?
Nathan Baca, WUSA 9.
Okay, Nathan?
Yes, I have 2 questions for 2 separate reporters. First one, there have been multiple positive cases of COVID-19 at Whole Foods on P Street, and according to DC Health, essential businesses are not required by law to notify public when an employee tests positive. Can you explain why that is, and wouldn't notifying the public of these positive cases help keep the public safe?